Vanakkam. Syndactyly refers to fused fingers, isn't it? Right? So the surgery is quite simple, isn't it? You just have to separate the fingers. Yes, but you have to ensure a few things. The tip of the finger should have good skin. You should try to avoid grafts as far as possible. The web space should be maintained even as the child grows, and as the child grows, there should be no contracture either in the forward direction or in the lateral direction. Can you ensure all these? Yes, you can, provided you follow the basic principles of syndactyly release and understand what is going on within the syndactyly. It is not getting a good release of the fingers on the table. It is ensuring that as the child grows, the fingers grow normally and do not face any problems. And that is what we are going to see in this video on basic principles of congenital syndactyly release. Before understanding the principles of syndactyly release, we need to understand what is syndactyly, how it is classified, the associated syndromes, and the basic disease process that resulted in syndactyly. Firstly, we know that there are many congenital differences in the hand. Where does syndactyly fit in? IFSSH classification based on Swanson's method consisted of 7 categories: failure of formation of parts, failure of differentiation, duplication, overgrowth, undergrowth, constriction band syndromes, and finally generalized anomalies and syndromes. The second category of failure of differentiation consisted of syndactyly and contracture. The basis of OMT classification is that all congenital differences are placed within one of 3 groups according to the dysmorphology. So all congenital differences can be placed under the group 1, which consists of malformations, group 2, which consists of deformations, and group 3, which consists of dysplasias. So the dysmorphology could mean malformations, deformations, or dysplasias. These malformations can be classified according to whether they involve the entire upper limb, and this occurs due to abnormal axis formation in the early limb patterning period, or the malformations could involve only the hand plate. So here it is abnormal axis differentiation, and it occurs during late limb patterning or differentiation. Syndactyly is classified under this hand plate malformation. Let us see how. Hand plate malformations can affect the proximal distal axis, radial ulnar axis, dorsal ventral axis, or an unspecified axis. Under this malformation of the hand plate of unspecified axis, we could have soft tissue involvement, skeletal involvement, or complex involvement. Simple syndactyly falls under this soft tissue involvement. Osseous or complex syndactyly, clinodactyly, Kerner deformity, and synostosis or symphalangism fall under the skeletal involvement of the unspecified axis, and syndromic syndactyly like Apert hand or synpolydactyly come under the complex involvement of the unspecified axis of the hand plate malformation. What is syndactyly and when do we say it is syndactyly? The distal end of the normal web lies on the palmar side roughly at the middle level of the proximal phalangeal region. A finger web that is more distal to this is called syndactyly. Syndactyly or fusion of the fingers is one of the most common congenital hand malformations that can be seen. It has an incidence of 1 in 2000 live births, and familial syndactyly is reported in about 15 to 40% of syndactylies that are seen. 50% of the patients have bilateral involvement, and males are more commonly affected with syndactyly than females. According to the incidence of the fingers that are involved in syndactyly, it has been seen that the middle and ring fingers are involved in the syndactyly most commonly, involving almost 50% of the cases. The ring and little fingers are involved in 30% of the cases, and index and middle finger are involved in 15%. Syndactyly between the thumb and index is around 5%. Before we learn about the different types of syndactyly, let us try to see how we should give a diagnosis for a patient with a syndactyly on the hand. This particular case would come under the diagnosis of primary congenital syndactyly between the middle and ring fingers of the left hand, which is non-syndromic, complicated syndactyly with no other anomalies. Let us see how and why we made this particular diagnosis. The congenital syndactyly refers to the etiology. It refers to primary syndactyly. The middle and ring fingers of the left hand, of course, indicates the involvement in the hand. The term non-syndromic refers to the association of the syndactyly with syndromes. The term complicated refers to the clinical presentation, and the term no other anomalies refers to the presence of other anomalies in the hand. So if we need to study about the clinical diagnosis of syndactyly, we need to know four things: the etiology, the association with syndromes, the association with other anomalies in the hand, and the clinical presentation. As far as etiology is concerned, primary syndactyly refers to syndactyly occurring at birth due to congenital problems. There is another entity called secondary syndactyly, which could occur after the separation of the fingers during the development of the hand plate, and these changes can occur either in utero or after birth in the postnatal period. In utero, secondary syndactyly can occur in many situations, like the condition called constriction band syndrome or acrosyndactyly. Postnatal secondary syndactyly is syndactyly or fusion of the fingers occurring after the birth of the child, as in conditions like epidermolysis bullosa, burns, or after surgical procedures where the fingers are put together to create a secondary syndactyly that will aid in the reconstruction process. We also need to see whether the syndactyly that is seen in a patient is associated with syndromes. It could be isolated or non-syndromic, where it is the only congenital problem that is present in the hand, or it could be a part of a syndrome which could involve other parts of the body also, or it may not be part of a syndrome, but it could be associated with other anomalies on the upper limb or hand. This example shows an isolated or non-syndromic syndactyly involving the middle and ring fingers. When the syndactyly is part of a syndrome, it could be a part of Apert syndrome, where the hand appears like this, with X-rays showing the different bony involvement and the facial features which are very characteristic of Apert syndrome. The fused fingers could also be part of a Poland syndrome with characteristic features on the X-ray and hypoplastic features on the chest wall. We shall see more about the asyndromic and syndromic syndactyly in the later part of this video. And thirdly, it could be associated with other anomalies on the upper limb or hand, like brachysyndactyly. Here, the fingers are fused together, but there are other features suggesting anomaly in the hand. Like for instance, here there is a shortening of the fingers along with the fusion called brachysyndactyly. In this example also, there is a syndactyly between the index and middle fingers, but there is also a loss of the ulnar side of the hand. So this is a case of ulnar longitudinal deficiency. In this example, there is a syndactyly between the index and thumb, but the diagnosis here would be a cleft hand, of which syndactyly is a part. According to the presentation of the syndactyly, it could be An incomplete syndactyly involving soft tissues only and not extending to the tip of the finger. Complete syndactyly involving only the soft tissues and extending to the tip. Complex syndactyly with distal bone union, or complicated syndactyly with more than only distal bone fusion. Incomplete syndactyly involves fusion of the soft tissues only between fingers, not extending to the tip, as shown in this example of syndactyly between the index and middle fingers, which extends only up to the middle phalangeal region. Complete syndactyly refers to fusion of the soft tissues only but extending to the tips of both the fingers. In this example of syndactyly between the middle, ring and little fingers, you can make out an intact skin bridge between the nail plates of the three fingers. This suggests that it is a complete syndactyly involving only the soft tissues, and an X-ray proves that there is no union between the terminal phalanges of these fingers. Complex syndactyly refers to fusion of the fingers with distal bone union. In this example, just like the case we had seen earlier, there is a syndactyly between the middle, ring and little fingers, but you will note that there is no intact skin between the nails. This suggests that there could be a fusion of the terminal phalanges, and the X-ray aptly proves this point. You can see the fusion of the distal portions of the terminal phalanges of the middle, ring and little fingers. So it is a complex syndactyly. Complicated syndactyly refers to fusion of fingers with more than only the distal bones being fused. This means that other bones of the fingers can also be fused, as in this example where there is a syndactyly between the middle and ring fingers, and the fusion of the bones extends along the terminal phalanx, middle phalanx and also part of the proximal phalanges. Our further discussions on congenital syndactyly in this video will be in the form of question and answer sessions, where we shall deal with all the aspects of basic concepts of syndactyly. What is the meaning of the term syndactyly? Syndactyly is a word derived from Greek, where syn means together and dactylos refers to digit, which could be finger or toe. Is it genetically inherited? Yes, 30% of congenital syndactyly is inherited. And how is it inherited? It is transmitted in an autosomal dominant pattern with variable expressivity and incomplete penetrance. It has been identified on chromosome 2, and mutations have also been seen in the HOXD13 gene, which is also on chromosome number 2. How does syndactyly occur? Syndactyly results from a failure of differentiation. That is, there is a failure of the digits to complete the normal process of separation. So what is this normal process by which the finger and finger webs are formed? The hand segment forms a paddle called the hand plate at around the 5th week of gestation. At around 48 days, 4 ridges develop in this hand plate. From these ridges, the process of apoptosis, that is, programmed cell death, begins, and this is mediated by the apical ectodermal ridge, and this proceeds in a distal to proximal fashion. So by this process we can understand that the finger webs are the last to form, and this is completed around 51 days of gestation. The first to separate is the thumb index finger. After the separation, the digits undergo segmentation and the development of touch pads, which occurs at around 56 days of gestation. What is the pathological anatomy of syndactyly? There are 4 important points to remember. First, the skin and subcutaneous tissues are normal. Second, there are tight facial bands between the fingers, and there is an abnormal thickening of the palmar fascia like the Cleland's ligament and the Grayson's ligaments. Thirdly, there may be an anomalous sharing of the musculotendinous units, nerves and vessels between the fused digits. And finally, the growth will be affected. That is, there will be a progressive angular deformity of the longer finger that is involved. As in this patient, where the middle ring and little fingers have been involved, the middle finger and the ring finger have restricted growth, which can be seen by the angulation in the fingers, both on the sagittal axis and the coronal axis. So this child has a fusion between the middle, ring and little fingers involving both hands, and there is an angular deformity in the middle and ring fingers. The nails are fused with the ridge present between the adjacent nails. This suggests that the bones, that is the terminal phalanges of the three fingers, may be fused also. You will also note that the creases are well developed at the PIP joint on the volar aspect, but there are only faint creases at the metacarpophalangeal joint and the distal interphalangeal joints. This suggests some restriction of movement at these joints, but the active range of movement is full at the MCP joint and the PIP joint. But there is a restriction of movements at the distal interphalangeal joint. Let us see what is non-syndromic syndactyly. Here, syndactyly alone is present. It may involve the hands and feet, and this is usually inherited. How many types of non-syndromic syndactyly are there? Temtame and McKusick in 1978 classified non-syndromic syndactyly into 5 types. But this was modified later by Malik et al. Into 9 types of non-syndromic syndactyly. Let us see what these 9 types are. Type 1 or SD1 is the most common. This is further subdivided into 4 subtypes. Subtype 1A or zygodactyly being the most common. Syndactyly type 2 or SD2 involves syn-polydactyly, which is further divided into 3 types. Syndactyly types 3 to 7 have their own names and own phenotypic presentations. Syndactyly type 8 is divided into 2 types, while syndactyly type 9 is known as the Malik-Persson type. So far, we have seen the 9 types of non-syndromic syndactyly. So what are the syndromes that could be associated with syndactyly? There are 6 main syndrome complexes that could be associated with syndactyly. Poland syndrome, constriction ring syndrome, acrocephalosyndactyly syndromes, acrocephalopolysydactyly syndromes, orofaciodigital syndromes, and oculodentodigital syndromes. Let us now see the main features of these syndromes so that we can recognize them or look for them when we come across these conditions. Poland syndrome is associated with aplasia of the chest wall muscles, which is unilateral, and symbrachydactyly of the hand, which occurs on the same side as the aplasia of the chest wall muscles. This shows the typical pattern of syndactyly that occurs in Poland syndrome, where there is a shortening of the fingers due to absence of the middle phalanx of the fingers, hence known as symbrachydactyly. When we consider the constriction ring syndrome and the syndactyly that occurs in this condition, there are 4 categories as described by Patterson. The first is simple constriction rings. The second is constriction ring with deformity of the distal part like lymphedema. The third is constriction ring with distal fusion of the fingers called acrosyndactyly, and fourthly, amputation of the fingers. That is type 1 with simple constriction rings, type 2 constriction ring with deformity of the distal part, which is usually lymphedema, type 3 constriction ring with distal fusion of the fingers called acrosyndactyly. Here we should note that even though the distal portion of the fingers are fused, there will be a sinus tract representing the finger web that had been formed normally. and type 4 where there is amputation of the distal portion of the finger. In this example, you can see the constriction ring, the distal lymphedema, the amputation that has occurred, and the acrosyndactyly that has occurred, that is fusion of the distal portions of the finger. The third type of syndromes associated with syndactyly are the acrocephalosyndactyly syndromes, and there are 5 basic types of these syndromes. They are the Apert syndrome, the Crouzon syndrome, the Sétre-Shorten syndrome, the Goodman syndrome, and the Pfeiffer syndrome. Of these, the two most important are the Apert syndrome and the Sétre-Shorten syndrome, and we shall see their main features. Apert syndrome is characterized by widely spaced eyes or hypertelorism, bulging eyes, and downslanting palpebral fissures, maxillary hypoplasia, palate abnormalities like cleft palate may be present, and syndactyly between fingers. We shall now see the characteristic features of the syndactyly that occurs in Apert syndrome. There are 3 types of syndactyly here. The first type where the thumb is free, but between digits 2 to 5 there is a complex syndactyly with fusion of the terminal phalanges. In type 2 there is a simple syndactyly involving the thumb, but there is a complex syndactyly involving the other digits. And in type 3 there is a complex syndactyly involving the thumb also along with the other digits. In the Sétre-Shorten syndrome, there is an asymmetrical head and face due to craniosynostosis and ocular hypertelorism with shallow eye cavities. Cutaneous syndactyly of the fingers and toes are noted, and the intelligence is usually normal in these patients. The fourth type of syndrome complex associated with syndactyly are the acrocephalopolyssyndactyly syndromes, and there are 5 basic types here: the Nowak, the Carpenter, the Sakati, the Goodman, and the Pfeiffer syndrome. Of these, we shall consider the Nowak syndrome and the Carpenter syndrome so that we do not miss these conditions when we see them. The Nowak syndrome, which has been identified as a type of Pfeiffer syndrome, is associated with craniosynostosis, conductive hearing loss, and polydactyly involving mainly the thumbs and the big toes. In Carpenter syndrome, along with syndactyly and polydactyly, craniosynostosis associated with acrocephaly or brachycephaly, short stature, congenital heart defects, umbilical hernias, and undescended testis may be seen. As the name suggests, orofaciodigital syndromes involve the oral cavity, the face, the syndactyly of the fingers and toes, cleft lip and lobe-shaped tongue, and there have been around 14 types of OFD, that is orofaciodigital syndromes, identified. The oculodentodigital syndromes involve, along with the syndactyly of the ring and little fingers usually, abnormal cornea, slender nose with narrowing of the nostrils, and defective enamel of the teeth and dry hair. Before we proceed further, we need to explain a few terms that we would come across when dealing with congenital problems in the hand, especially syndactyly. The terms brachysyndactyly, symphalangism, and superdigit. Brachysyndactyly refers to associated shortening of the syndactylized digits. This is usually associated with Poland syndrome, and we have already seen an example of this. Symphalangism refers to congenital stiffness of the interphalangeal joints, commonly the proximal interphalangeal joint. So, the phalanges are also fused together. Hence, there will be no movement at the interphalangeal joints of these syndactylized fingers. And finally, the superdigit, where there is an abnormal ratio of metacarpals to fingers. There are 2 types here. The type 1, where 2 metacarpals support a single digit, and type 2, where a single metacarpal supports 2 digits. So, having understood the basic concepts of congenital syndactyly of the hand, What we need to understand now is the management of syndactyly, the principles of surgery, decision making in different types of syndactyly, and also the technique of surgery. But all this we shall deal with in our next video in this series on congenital differences in the hand. I hope you liked the video. I enjoyed making it. Please do click on the shown links to see more about other congenital problems. And do not forget to subscribe to stay connected with the latest in learning hand surgery, plastic surgery, trauma surgery and ethics. வணக்கம்.